Turning now to today's medical rounds. As the weather gets colder, it is important to start taking care of your skin. Joining me now to talk more about some common skin conditions during the colder months, like psoriasis, is Dr. Emily Shaughnessy. Thank you so much for joining us, doctor.
Thanks for having me.
So let's talk about psoriasis. What really causes it?
So the exact cause of psoriasis isn't known. We do know it to be an immune-mediated condition that causes our skin to turn over faster than normal skin, which is why you get those scaly plaques. It's thought to be both due to environmental causes as well as genetic factors. But it's really important to know that it's not contagious, so you can't give it to anyone and no one can pass it to you.
And what are the symptoms?
So the symptoms can be very variable depending on what type of psoriasis you have. But most commonly, we see patients with red, scaly plaques on the elbows, knees, scalp, and sometimes even the other parts of the body. It can also involve the fingernails. So sometimes people have thickened nails with pits or ridges. And it can actually also involve the joints. About 30% of patients with psoriasis also have joint involvement, which we call psoriatic arthritis, which is important to find so that we can treat.
Okay. And what would be the difference between, say, moderate and severe plaque psoriasis?
So it's a great question. When we think about psoriasis, there's a lot of factors to consider, but in general, we measure psoriasis by body surface area. And body surface area, we take our palm, and our palm is about equivalent to 1% body surface area. So in moderate psoriasis, we generally think of about 3 to 10% body surface area. And severe psoriasis, we often think of greater than 10% body surface area. But we also have to take into account how uncomfortable people are or if they have joint involvement.
So how do you treat a patient who comes in with psoriasis? Is there hope?
There is. We have so many great treatments. A little bit of it depends on the severity. So for more mild cases, we can often do just topical treatments, such as topical steroids. We also have this really cool medical grade light box that we use ultraviolet rays to treat the skin. That's incredibly effective for psoriasis. And then for more moderate to severe psoriasis, we have systemic treatments, including both pills and at-home injectable medications that you can use. And you may have even seen some of them, some of those commercials on TV for those medications. But they can be extremely life-changing for our patients.
All right. Well, thank you so much for joining us today. We want to let folks know that they can find more on your interview and anytime right on the Channel 3 app and to reach out to Hartford HealthCare for more information. Thank you so much for being with us, doctor.